Hey, good morning. This is my 6 day post up, and I need to talk about the sleeping. Today was yesterday was my first day sleeping for like a long time. I haven't been sleeping a lot. I guess the pain pills. I'm taking less of the pain pills than I'm taking. I'm still yarded, and I'm not tired. Excuse me. And I'm taking more regular Tylenol. But it seemed like them pain pills wouldn't let me get any sleep. Um, I feel better as the anesthesia is really wearing off. Seemed like it took a long time to wear off my body, but I tell you, the thing that really helps me is walking. Y'all, after y'all have surgery, walk much as possible. Just walk, 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 walk. Yesterday I went to Walmart. That wore me out. I guess I needed that little trip out. I just took my time. I didn't pick up on anything. Like I said, I still have my nurse. My husband has gone back home, but I still have my nurse, so my nurse has been helping me. And I've been paying for the 24-hour nurse, and it's not bad like I thought I would have. Nurse, home care, you know. Well, today is my 6 day post-op. I'm not experiencing pain. Well, maybe little pain. Those little pain and burning from the lipo, like the little jab I was talking about. What else? I'm still yawning. I'm not tired, y'all. I just slept so much. Just it's a process. It's a process. Oh, I started experiencing that itching a lot. Itching a whole lot. My drain is draining less fluid. One is draining like 25 and one is draining like 50. So that's pretty good. But I want to try to keep the JP drains on long as possible. But I also hear say the longer you keep them on, the more you increase your chance for infection. So I gotta start taking like little pads or little Q-tips and clean them around them because I don't want any infection. My doctor's talking about leaving my JP drains on, especially if I'm draining for like 2 weeks. 2 weeks. I don't want a seroma. That would be my biggest worry if I would have to take the drains off earlier. Otherwise, I'm doing pretty good. Oh, I'm still yawning, y'all. I'm sorry. I'm about to get up out of this bed and drink put on some water for some ginger tea. The nurse have been making me the ginger tea with the crystal ginger bag. This is my first time ever taking a ginger tea from the crystals, but that was pretty good and it didn't affect my medication. Everybody is different, but she talked to my doctor before giving me the ginger tea, and it seems like it helps me with the cold that was inflamed in my chest. I don't even have any more cold like I had when I first started out. But it's helping with that. And now I'm trying to do more for myself. Even though I still have my nurse, I'm trying to do more for myself. Like get up and walk around and do a little things. Not too much reaching. She's putting everything where I can reach it. When I get up, I'll take y'all in the kitchen and I'll show you different things. How she has it placed on the cabinet just so I can reach it and just so I can grab it. So I won't have to overreach, hurt myself doing too much. But it's also important that you try and around the 6th day, 5th day, start trying to do little things for yourself. Not too much because you don't want to overdo it, but especially if you're going to work, say like you take 7 days off, it's important to try to start doing things for yourself. That can be your part of your stretching routine because it's important to stretch, not not doing shit decision. You don't want to stretch that out, but stretch, like your arms and your just stretch. It helps. My stomach is getting better. At first, like first few days, like the 2nd day, I started hearing like a lot of growling, like and stuff like that. I don't hear that much. It's usually like after I eat and stuff like that. It's calming down. So that's getting better. I'm getting hungrier for food. So like I said, this is just it's a big process. When you have surgery, you're not gonna be hungry right away, but you need that food to help. You need that protein to help strengthen your body so you can get better. It seemed like when I started putting more in my stomach, like a little more food, I'm getting stronger. I can feel it strong every day. I'm just praying that my incision doesn't stretch out too much. I haven't seen myself yet, but like with everything off, but I'm so happy with what I see so far. I'm happy about that. I'm just so excited because I've always wanted to do this, but I just was so afraid of anesthesia. That's scary for a lot of people, but it's not that bad. It's really not that bad. I guess, when you're watching those videos and constantly on Instagram and there's so much happening, dogs dying every day, it can be really scary. Really, really scary. So I advise anyone that's about to get surgery and this is your first time doing it, cut some of that stuff out. If you're on Real Self, don't look at it that much. Just go on there to update your information, and if there's questions that needs to be answered, then answer them. But don't sit on there every day. That's exactly what I was doing. Even when I was at work, I was getting on Instagram, constantly reading messages, and on YouTube all the time, just watching, because YouTube is very informative, but it can be too much sometimes. So I kind of had scared myself half to death. You don't want to scare yourself half to death. You don't want to scare yourself half to death. I scared myself half to death that I needed to take anxiety meds. Surgery is a big old thing. It's really a big, big thing. Big thing. Because it's important. You want to feel better. I have been paying money to go to the gym for such a long time. Lies. People feed you lies, not knowing that because of my muscles are so messed up that it won't heal like that. Well, for me it didn't. Everybody's different. I'm speaking for myself right now. But still spending money on products that's supposed to make your muscles tighten or your skin tighten. Lies. So I just decided to, after weight loss, get a tummy tuck. I've always wanted to be able to wear decent clothes. The clothes are ugly. You can't. Your pants is not right. Stuff just don't fit right. You all bungle up in the front. enough. You just not right. Sit up a little more. But I'm ready to go back to work already. I got a phone call. It's time to go back to work, but I can't. And I've been talking to a few people, and they told me they experienced, as far as going back to work too early, it kind of compromised their surgery and stuff like that. Some was in pain. Some people mess their muscles up, so I'm not trying to do any of that. I'm gonna take my time because this was like a 6-hour surgery. He took like 800. I remember 800. I don't remember what he said, 8 something. That's more than what I thought he was gonna take of the fat. I had a lot of skin. That skin was thick. Look like I'm gonna have to need a little tin lipo or a skin graft or something. I had to lose weight. I had to do this for myself. So important. Now I looked in the mirror. I can't see everything because I can't. Well, I can see my. Now I couldn't see that at first, but I'm still wrapped up. Still have my binder on. I'm wrapped like twice with the binder, so I can't see what's under there. But I can see different things already. But now that I can see my stomach is gone, I can see other things that may be a problem. Now I guess it's just after you have surgery. But I'm gonna try to work some of that stuff out. Like I see where my skin, like my back area, I have to take a picture and show y'all because I've lost weight all over, and it seemed like I may need like what is that? A body lift, you know? It seemed like I may need a body lift. Skin just hanging. Look at that. And I was not doing too much cardio when I was losing weight. I did keto and I did the J.J. Smith cleanse. But my skin is still hanging everywhere. So we'll chat later, y'all. We'll chat later. If y'all haven't subscribed to my channel, go ahead on and subscribe. I don't have that little that little button, but I'm gonna have to put that in place so I can make it easier for y'all. See you later. We'll talk later.